Okay, so welcome everybody to this short webinar, short presentation about Crohn's, ulcerative colitis, and all kinds of gut information too. It's primarily designed for people who are suffering or who have loved ones that are suffering, and it actually is quite close to me because my mother has Crohn's disease. She's had it since the 1950s, and in the 1950s, of course, they didn't have any of these smart drugs. They had to cut a bit of the bowel out, otherwise you could die. So she was rather unlucky and had part of her bowel taken away. That left her. She decided not to go for the colostomy bag, and so she's had lifetime diarrhea, which obviously has affected her general health. Of course, although she's done remarkably well. I mean, thanks probably to homeopathy, because I've been there to sort of sort out things as they come up. And so she's actually remarkably amazing for 93. She's still going, still got her mind, no dementia, and actually sometimes looks younger than me, which is a bit embarrassing. Anyway, let's press on it. And if you've got questions, you can either pop them in the chat box or just unmute yourself and switch your video on, and you can actually, you know, present it live. Um, so let's press on. First of all, I want to say I do have a Facebook group which you might be interested in if you're not already a member. You can join us completely free, of course, and there's all sorts of information on there. And it's a forum where homeopaths and patients and anyone connected with inflammatory bowel disease can get information and swap stories and information, and yeah, it's like a sort of an information exchange really. So you just need to search for homeopathy and Crohn's on Facebook and you should find it. I think that's the full title of the group, and you'll be very welcome there. um so let's I'm just going to talk a little bit about the different types of inflammatory bowel disease at first, because there's probably some confusion um, about that. So let's start with Crohn's disease, and we can look at the differences, so we're not in any confusion. So where is Crohn's disease located? Sometimes a lot of people get confused between Crohn's disease and ulcerative colitis, particularly. So Crohn's disease is found anywhere in the digestive tract, but often affects the end of the small intestine and the beginning of the colon, whereas ulcerative colitis is only in the large intestine, so that's the colon and the rectum. So the symptoms of Crohn's disease can be quite varied: abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition, and it can be quite dangerous, so it does need attending to. Um, Inflammation, patchy, affects multiple layers of the bowel wall, and these so Crohn's disease, ulcerative colitis are autoimmune diseases, and we'll talk a little bit about that later. So ulcerative colitis is only, as I said before, it's only in the large intestine, and the there is often bloody diarrhea, um, pain in the abdomen, cramping. So it can seem a little bit similar, rectal pain, and actually sometimes it's difficult to differentiate. I think there are certain tests which can positively identify whether it's ulcerative colitis or Crohn's disease. Continuous inflammation along the colon, but affects only the innermost lining. And complications increase risk of colon cancer and also perforated colon, which we don't want, obviously. And so irritable bowel syndrome is very different. One, it affects the large intestine. It sort of mimics um, it mimics those inflammatory diseases, but it's not nearly as serious, and it's often a sort of a stress related thing, as is actually Crohn's and ulcerative colitis is also can be very stress related, but it's more chronic. Irritable bowel syndrome can get flare ups when somebody's feeling stressed out. Cramping, abdominal pain, bloating, gas, diarrhea, or constipation, but not really, no blood normally, no inflammation or tissue damage. It's often managed with diet and lifestyle changes, and of course homeopathy. So we want to really treat the whole person, not just the symptoms, because then you get a really good, you can get a cure, or you can get much better results than if you just treat the sort of symptoms that are uppermost. Celiac disease affects the small intestine. Basically, it's triggered by gluten, and you get diarrhea, fatigue, weight loss, bloating, and gas, and abdominal pain. So, it sort of can look similar to Crohn's or ulcerative colitis, but it's particularly triggered by gluten. Complications, nutritional deficiencies, osteoporosis, and infertility. Now, diverticulitis, can be very uncomfortable, primarily affects the colon. Basically, it arises from little pockets, inflamed pockets, which sort of collect these little pockets in the intestine wall, which then can be can collect sort of food and get inflamed and lead to sepsis, and it can be quite painful, abdominal pain. There can be fever, changes in bowel habit and tenderness, and it's often treated with antibiotics. Complications can lead to abscess formation, perforation, or fistula formation in severe cases. Often it's as you get older that diverticulitis, I think, becomes more common. So Crohn. Now, I want to just say something about bowel resection, in other words, bowel surgery and the benefits and other um, and the other results from this it's quite brutal, really. I mean, it's having a piece of your bowel taken away. Benefits: temporary symptom relief, potential for disease recurrence, though. Complications: risk of infection, obstructions, and post-surgical challenges. I was treating somebody recently who had this done, and it's not a pleasant thing, and it needs a lot of management, basically. And then you can have a colostomy bag, um, and but that obviously has an effect on your lifestyle. Um, with ulcerative colitis, uh, it can having a piece of your bowel taken away can actually potentially cure and at least relief from symptoms. But there's a psychological impact, and again, there's the stoma post-surgery, and there's a lot of ongoing care and monitoring and post-operative health. So in homeopathy, we really want to deal with the root cause of these things. We want to sort of take out the root of this weed, if you like, not just put a band-aid over the symptoms. It's a bit like you're driving along in your car and the oil light goes on, and you stop the car and you think, right, I'll just rip the oil light out, that'll cure it. But it doesn't, of course, and then the engine fails. So it's a similar thing. If you just deal with the symptoms, you're not really dealing with the sort of the thing, what is really causing this, the sensitivity. So in homeopathy, we treat the sensitivity rather than the symptoms, and we get better results. Okay. type of ostomies, so type of bags that are fitted after surgery. Surgically created colostomy, surgically created opening of the colon through the abdominal wall, and then ileostomy is a surgical procedure that diverts the small intestine to the abdominal surface. Um, so these systems are designed to divert waste from the body for individuals who have undergone bowel resection surgeries. And they can play a role. I mean, obviously, this is one option. They can play a role. I think the thing is that people tend to think, when you hear someone say, "I've got Crohn's disease" or ulcerative colitis, you immediately think, well, that's a disease for life. There's no cure for that. That's what people think. But I think when you see, I'm going to present a couple of cases, and hopefully you'll see that a lot is possible without having to resort to uh, drugs, you know, quite toxic drugs and other surgical procedures. Again, any questions, just drop them in the chat box, or just unmute yourself and come online. So I wanted to show you some of the drugs that are used for inflammatory bowel disease. So aminosalicylates, so that's salicylates related to aspirin, of course, reduces gut inflammation for mild to moderate ulcerative colitis, and those are some of the drugs they use. Corticosteroids, of course, or cortisone or steroids, suppress inflammation, immune response. Obviously, they're very powerful drugs. They work very brilliantly, but they're not something you can take forever, and they can have obviously very powerful side effects as well. But for moderate, severe to severe flare-ups, immunomodulators, they suppress the immune system to maintain remission, used in both Crohn's and ulcerative colitis. And then biologics. And I have a bit of a problem with biologics because they are incredibly effective. In most cases, they really do, I mean, cancel out the symptoms. But then you're sort of hooked on that, because trying to treat someone when you can't see the actual symptoms is very difficult in homeopathy. We really like to see something of the symptoms so we can prescribe. They help us in the prescription. But the biologics are very powerful, and occasionally I've had to sort of tell the patient I can't really help them if they're on the biologics. It's like that is a certain sort of a road to go down. For me, maybe other people can work with it, but not me. Antibiotics can treat flare-ups and complications, and then of course there are pain relievers uh, like paracetamol and uh, ibuprofen. But people are generally advised to avoid the NSAIDs, the ibuprofen type drugs, because they can worsen the symptoms. They seem to have an effect on the stomach and presumably the whole of the gut. So that's all fun, isn't it? That's the fun bit. No, this is the fun bit. So, why do some people develop inflammatory bowel disease and not others? So, in homeopathy, we see ulcerative colitis and Crohn's as very destructive diseases, but they're also autoimmune diseases. So that means uh, the body's attacking itself. And there are a number of possible etiologies, in other words, causes of these rather nasty diseases. One is possibly vaccination. Vaccination is responsible for a lot of problems, not just bowel diseases, but other things which we won't go into, but certainly neurological problems and yeah, I mean the tests, the studies that have been done are comparing kid people or kids that haven't been vaccinated with those that have been vaccinated show a great difference in chronic disease. Those that have been vaccinated tend to get a lot more chronic disease. Heredity is also a problem, especially where there's, I think, cancer. Um, and the other thing I found is that these people often have a high amount of responsibility in their lives. They often take their families very seriously, and that can lead to a lot of stress and then body inflammation. And it can come from a trigger of like food poisoning, norovirus, or even COVID. So, um, and it can help us to know if there is a cause, then it can help us to know in when we're taking the case in a homeopathic context, it can help us to know what the cause was. Okay. Oops. So homeopathy focuses on the underlying cause, the autoimmune disorder, in other words, the tendency of the body to attack its own cells. That is the actual problem. And the symptoms are just the result of that. The symptoms are not the disease. Symptoms have a root cause, which is how we understand it in homeopathic terms. So I want to present, first of all, a Crohn's disease case that I treated 2 or 3 years ago. And it's very interesting. So this guy, he's 54, or he was 54. He was an IT professional, and he's got quite serious Crohn's disease. Previously very fit and active, and then all his intestinal problems started in 2016 after food poisoning. But I think the food poisoning was the trigger. I think there were other causes as well. So he was hospitalized with severe abdominal pain and bleeding. Um, and since then, he's never been well since then. He's got sensitivity to certain foods. He has fatigue and brain fog. He sweats easily. He has to really be careful with his diet to manage the symptoms. And uh, I'm sorry, I just need to go and get a glass of water actually, because I'm getting quite dry in my mouth, and I've normally have a glass of water here, but I forgot on this occasion. So if you don't mind, I'm just going to pop into the kitchen, get a glass of water, and I'll be back in just one moment. Okay, little intermission there. Okay, so these are the foods, as you can see, that aggravate him, upset him. Dairy products, eggs, I mean, red meat. It makes his diet incredibly restricted. Raw foods, some vegetables, certain fruits, chocolate, nuts are better, especially walnuts and cashews, which is interesting because often they are responsible for other kinds of autoimmune conditions like anaphylaxis. Cooked foods, preserved fruits. He also has an intolerance to some probiotics, things like acidophilus, for example. He's actually a herbalist, or he practices herbalism, and he finds slippery elm is quite helpful, and that is a good adjunct to think about slippery elm, which you can buy from some herbal suppliers and health shops, and just being careful with his diet is the way he's handling it. He's very independent, skeptical of conventional medicine, low energy and anxiety, low confidence. He has a history of really very stressful life events and relationship difficulties. Um, and I think this disease has caused him to sort of withdraw from life a little bit, so not so sociable. Um, so I was very pleased that he approached me for treatment. Um, I mean, he had some really profound just abuse from his family, and yeah, he's a gay guy, and I think that was part of it. And he had some real problems with his family that left scars. So the first remedy I gave him, or the first remedy that caused a real shift, I gave a couple of remedies that did a little bit, but the first remedy that caused a real shift is called Oleum jacoris acelli, um, which is cod liver oil in common parlance, and it's a very interesting remedy. Let's see. Cod liver oil is a complex substance, so it's got lots of mineral substances in it, and so it can look a bit like other remedies. It contains a lot of phosphorus and also calcium. It's important in calcium and phosphorus metabolism. And that was the first remedy I gave him. So not as a supplement, not like cod liver oil, but as a homeopathic remedy. So highly diluted and prepared in a homeopathic manner. This was the feedback after a week after. He had a very cathartic emotional experience. So with homeopathy, everything is joined up. So of course, his emotional state is absolutely it's so important when treating the actual Crohn's disease. You cannot separate the physical from the mental, emotional. And so the fact that he had does not, a cathartic emotional experience doesn't surprise me at all. Often there's a kind of a clearing out sense of clearing out. The body and the person has to clear out both his body and his mind as well. It was after watching a film, and he had an important insight regarding childhood grief, connected to the death of his grandmother and the impact of unacknowledged grief within the family system. He recognized a pattern of self-blame. So there's a real shift and a real understanding and a deepening sense of what his past was about. He experienced a symbolic inner process of laying down inherited weapons, letting go of protective emotional patterns learned in childhood. He began a process of self-forgiveness and release of past burden. He felt lighter, and he viewed this as the start of an ongoing healing process. So he really appreciated the effect this remedy was having on him. So 10 weeks after this, mood is much better, energy a lot better. Let go of friends and family sort of abuse, trauma. Mood is so much better, no pessimism, a lot happier. But the gut is no better, which is interesting, isn't it? So that means there's something underlying that has not been touched by that remedy, and that's quite normal. Some cases have a more simplistic presentation, so that they can be just one remedy is all they need, and it reaches the whole of the person. But other cases are more complex, and it's almost like a layered approach is needed. He says, I need to be near a toilet all the time. These are the foods that really upsets him. This is the remedy I gave. It's a very interesting and unusual remedy, and it's called Joninum. The Latin name is Myco, uh, Myco, uh, hang on, Mycobacterium para, paratuberculosis. It's similar to the TB uh, organism, and it's particularly found in cattle, in the intestines of cattle. It causes chronic inflammation in the intestine in many species and causes a Crohn's-like wasting disease, which is why it came to the attention of homeopaths. And Lou Klein, particularly a great homeopath in Canada, did approving of paratuberculosis, this Joninum, um, and this was, according to research, it is now conclusively and irrefutably shown that this can be found within the tissues of a major proportion of Crohn's disease patients. So it's very interesting. So that was the connection. And it's got a very interesting picture. I'm not going to go. This is not really designed for homeopaths. This presentation is for the general public. So I'm not going to go into details. But it's a very interesting uh, remedy that's got a very interesting picture, and it's linked, definitely linked to Crohn's disease. This was the follow up. He actually had an aggravation. This is a normal thing with some cases. They get an aggravation of the symptoms, not in a dangerous way, but there's a kind of it's like, for example, sometimes when if you're treating a patient with a fever, the fever will actually go up and then come down after the remedy, and it's a good sign. The body's kind of clearing out the the issue, the problem. And this was the amazing thing. He said, I had lasagna yesterday, which would have caused him to be in bed for days, if not weeks. And the only thing that happened was a pimple on my face. And then really, really well. I've been eating things that would have put me in bed for weeks. No problem. Lemon and lime, raw vegetable juice, beetroot, corn, lentils, raw salad, they would have all have killed me. And he's able to eat normally. And this is the kind of shift we're looking for. It's all very well just sort of diluting the symptoms with a sort of band-aid approach. But what we really want to see is a total shift in the whole person. And so it's not just the physical symptoms, but he's also better in himself. He's got more energy. He's dealt with his emotional problems. It's all been it's all been addressed by the homeopathic remedies. That's Tim. Um, I don't know whether can we see a little bit of Tim? There's me.
Hello, everybody. I'm Jonathan Stallick.
We'll just
I'm
watch a little bit of
a
this.
professional homeopath. I've been practicing homeopathy for about almost 40 years now. I'm delighted to have Tim, who's here. He's a recent patient that I've been treating, and he's very kindly agreed to come and talk about the transformative power in his own real life experience of how homeopathy affected him. So, Tim, how old are you, and what do you do for work?
I'm 53, and I do an office job, um, doing IT stuff, IT support things. So it's not very exciting. It's sat behind a desk for minimum of 8 hours a day.
Right. Okay.
Yeah.
Okay. Thank you. And so, what was your life before homeopathy? What were the challenges you were facing, especially related to, of course, Crohn's disease? So, what kind of things were you facing?
Well, in 2020, just before the pandemic, I went to a carvery in Wimbledon.
I think
and I got dysentery.
You can see
it was
this on
so
my
bad, I ended up in hospital,
website.
an IV drip.
So I'm not gonna stop with that now. But I just wanted to sort of show you him. He is a real life patient, and he obviously was impressed enough to come and give a nice interview. So So Miriam, you're asking how did I get to the remedy Janinem? That's not for this presentation. This is for general public. I'm not really. It's not really addressing homeopaths. It's really for the general public um, to get more information and also to see whether homeopathy might be worth looking at for themselves or their loved ones. So you'll have to ask that in another presentation. Um, okay, so I want to. This is another case. This is an ulcerative colitis case, and this was Charlotte. She's a primary school teacher. She came with loose stools with blood. These are typical symptoms, occasion of ulcerative colitis. Occasionally, blood without a stool. She has a reaction to cocodamol, she was taking. Sharp stabbing pains after eating. She's also, excuse me, she's taking suppositories. But there's a general inflammatory process within her body, which is causing joint issues as well. So it's got wandering pains, which mean they go from joint to the pains go from joint to joint. It's randomly. And they're worse in the evening and during the autumn. And also, interestingly, due to school stress. Of course, being a primary school teacher, you have a lot of responsibility. So that has to be taken into account. Personal stresses. She started experiencing bowel issues in summer 2020 during COVID. And in fact, then a year later, her grandfather committed suicide. And so we can't link that to the triggering of the ulcerative colitis, although I'm sure it didn't help things. Also, and then her father died another 6 months later. Um, and also her husband, well, no, her potential husband, her fiance, she found out that he was having an affair. They had a wedding plan, all planned out, and then yeah, he was found to be having secret liaisons with somebody else. So obviously this was a lot of stress as well. But I think the interesting thing was that it was during COVID. I think it was the COVID lockdown that sort of caused the real stress. She's got a lot of responsibility. She's teaching year six, and she'd also just taken on mortgage responsibilities as well. Now, emotionally, she was affected by the lockdown. And the main thing that I got from her was that she was a very helpful person. She loved helping her family. And because of the lockdown, she was actually unable to use that energy in that sort of way. And it's obviously been internalized. And so she started sort of attacking herself. She's had high levels of responsibility from a young age. She feels a strong need to put others first. Um, Not just her close family, but anyone in her circle. History of genital herpes and cystitis. She's been on the pill, and so she's got night sweats. These are the kind of things we ask. The initial consultation, the initial homeopathic consultation is incredibly in depth. It goes in every aspect of your life. And so, yeah, whether you're hot and cold or cold and your emotional aspects and your lifestyle and your temperament, everything gets looked at. History of sleep issues that got worse after her grandfather died. Lots of dreams. Um, there's a fear of cancer because it's in the family history. I think I mentioned that can be predisposed to these kind of diseases. A lot of overthinking and burdened by responsibility. Um, and this is the remedy I gave her. And calichloricum is actually potassium chlorate. There are a few different. There's a few similar remedies. There's Kali muriaticum. It's not that. It's not the same. Calichloricum has a much more devastating effect on the body than Kali muriaticum. So this is the remedy I gave her, having taken into account all of the aspects of her mentally, emotionally, and physically. 3 weeks later, she has no issues. She hasn't had to use the cocodamol for 5 days, although she continues with the suppositories for now. Joint pain improved. Pain intensity reduced from 8 to 2. Pain is worse in the evening around 8 p.m. Relief from a warm bath. She's also starting to manage her stress differently. She's now asked the school if she can move from a stressful class, and so she's now experiencing less pressure. And I gave her a repeat of the calichloricum. However, and this is not unusual, so it seems like this remedy was partially indicated. In other words, did it did resonate with this case to some degree, but it obviously wasn't deep enough. And so she then started having a relapse of symptoms, and it was a little bit of a hairy time for everybody because we thought, oh my goodness, can we help this woman? And thankfully, I did a lot of research and found another remedy, and this was a plant remedy called Silene vulgaris. Its common name is bladder campion, and the plant remedies are really coming into their own in the last number of years, maybe the last 15 years. A lot of research has been done into the whole of the plant kingdom, and we are now able to sort of predict the therapeutic effects of any plant in the plant kingdom, whereas before we would have to do specific testing on each plant individually, which could take weeks or even months. And so this was a shortcut which allows us to predict with accuracy the effect of different plants. And so we're very lucky and found this plant. It's a rather pretty plant, isn't it? Unusual with these little bladders, as you can see. And this cured basically. All the symptoms receded, all the joint symptoms, all the bowel symptoms. She felt fine in herself, and she didn't need to come back. So I hope you can see from this that there is real hope for these seemingly incurable diseases. I mean, I don't like to offer guarantees because it's always about the individual person. And so, we're treating the individual. So we have to bear that in mind. There's no guarantees in anything, in any therapy, but we're seeing very, very hopeful signs in with these diseases, and that we can at least improve things dramatically. So I hope that gives you hope and inspiration. If you wanted to have a chat, if you've got this disease or anything or any other disease or illness or indisposition, you want to have a chat about it to see whether maybe homeopathy might offer something, then I offer a free video chat, and you can have all your questions answered. We can talk through whether homeopathy might be helpful for you, and I'll send you a link to that by email. And then once again, for those that didn't see maybe at the beginning, I've got a Facebook group, and you're very welcome to join. It's completely free, and it's an information exchange. Whether you're a homeopath or whether you're a sufferer or just somebody who's interested in homeopathy, then this might be worthwhile to join. Okay, well that's it. does anyone have any questions? Uh, if you've got any questions, now is the time to ask. Just put it in the. Um, well, there's a group of plant families that seem to come up time and time again. There's the olive family, and then there's this Caryophyllaceae family, and that seems to come up time and time again. But you can't really say those. They're not the only remedies, and there are some mineral remedies, and there's all kinds of remedies. But we're not going to go into that now. That's more for homeopaths. Seminar or forum. Anything else? Anyone else for? Okay, great. All right. Well, thanks for coming along, and I hope that was useful for you and helpful. And I will send you a follow-up email with a video. The video will be free of charge. And I'm sorry if anyone had problems getting into the room today. I'll make sure in future that I sort out that little gremlin. And I'm going to go and have some dinner now. Hope you have a lovely day or a lovely evening. Take care. Bye bye.